Well, our first advice has always been and remains to stay local, support your local economy. We have a beautiful environment in KFL&A in which you can have your staycation. So that's what I'm doing. I'm not traveling outside of the province. I'm trying to stay local and support our local economy. If you must travel outside of KFL&A, you must do what's called a risk assessment. You should be asking where you're going, what the incidence or occurrence of COVID-19 is in that community. What are you going to be doing in that community? Is it going to put yourself or your family at risk for any potential transmission of COVID-19? So ask the who, what, when, where, and why. And where you're going, you can get information on the ontario.ca website of current risk of transmission of COVID-19 across the province. And then if you're going to go visit family, ensure that you call ahead. You ask if anyone has the symptoms of COVID-19. So that's a fever and or a cough and or increased shortness of breath. And some of the minor symptoms can be even a sore throat, a change in your voice, some nausea or diarrhea. So ask ahead before you go and ensure that it's safe to go, and anyone in the home that you're visiting doesn't have signs or symptoms of COVID-19. If they do, ask in advance to get tested so that you can have some level of safety before you go. And then if you're going to go, ensure that if it's a higher risk area, that you still maintain good hand hygiene, that you wear a mask in public where you can't maintain physical distancing of 2 meters, and that you monitor yourself for any new symptoms, especially when you come back. The most at-risk individuals that come back to our community after have traveled are those that are working in congregate settings. By congregate settings, I mean if you're working in a hospital, a long-term care, a retirement home, a corrections facility, or any group home. If you've left KFL&A and you're coming back to work, we really would suggest you monitor your symptoms very closely for up to 14 days for any symptoms of COVID-19, such as fever and or cough and or increased shortness of breath, and even consider getting tested even if you have no symptoms. Our assessment centers will be open all summer and are a safe environment in which to get tested whether you have symptoms or you don't.